Colistimethate is an antibiotic that is used to treat specific bacterial infections. It works by preventing the growth of bacteria. This medication is usually given by injection into a muscle or vein as directed by your doctor. The dosage is based on your medical condition, weight, and response to treatment. It is important to continue using this medication until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may allow bacteria to continue to grow, which may result in a relapse of the infection. Take this medication at the same time each day to help you remember. If you have any questions about the use of this medication, consult your doctor or pharmacist. When using Coly-Mycin and Parenteral Vial, the dosage is typically based on your medical condition and how you respond to treatment. If you are administering this medication at home, it's important to learn the proper preparation and usage instructions from your healthcare professional. Before using it, make sure to check the product for any particles or discoloration. If you see either, do not use the liquid. It's also important to learn how to store and dispose of medical supplies safely. If you are inhaling this medication, make sure to learn how to prepare the solution and use the nebulizer machine correctly. It's crucial to use this antibiotic at regular intervals for the best effect. To help you remember, use it at the same time every day. It's important to continue using this medication until the full prescribed amount is finished, even if your symptoms improve after a few days. Stopping the medication too early could result in the infection coming back. If your condition does not improve or worsens, make sure to inform your doctor. Common side effects of Coly-Mycin and Parenteral Vial may include stomach upset and itching. If these side effects persist or worsen, it is important to inform your doctor or pharmacist right away. It is important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks. Many people who use this medication do not experience serious side effects. However, it is important to seek immediate medical attention if you experience any serious side effects, such as numbness or tingling, mental or mood changes, difficulty walking, unexplained fever, trouble speaking, muscle weakness, or signs of kidney problems. Additionally, this medication may rarely cause a severe intestinal condition due to a bacteria called C. difficile. If you develop symptoms such as persistent diarrhea, abdominal pain, or blood in your stool, it is important to inform your doctor right away and avoid using anti-diarrhea or opioid products. Prolonged or repeated use of this medication may result in a new infection, so it is important to notify your doctor if you notice any symptoms of a new infection, such as white patches in your mouth or a change in vaginal discharge. While a serious allergic reaction to this drug is rare, it is important to seek medical help immediately if you experience symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it is important to contact your doctor or pharmacist if you notice any other effects not listed. If you are in the US, you may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Before using Coly-Mycin and Parenteral Vial, it's important to let your doctor or pharmacist know if you have any allergies to Colistimethate, polymyxin B, or colistin, as this product may contain inactive ingredients that could cause allergic reactions. Be sure to discuss any medical history of nerve/muscle diseases or kidney disease with your healthcare provider before starting this medication. This drug may cause dizziness, and using alcohol or marijuana can intensify this effect. It's important to avoid activities that require alertness, such as driving or operating machinery, until you can do so safely. Limiting alcoholic beverages and discussing marijuana use with your doctor is also recommended. If you have surgery or a procedure requiring anesthesia or medications that block nerve or muscle activity, be sure to inform your doctor or dentist that you are using Coly-Mycin and Parenteral Vial. It's important to note that this medication may affect the effectiveness of live bacterial vaccines, such as the typhoid vaccine, so be sure to inform your healthcare professional before receiving any immunizations or vaccinations. For older adults, they may be more sensitive to the side effects of this drug, especially kidney problems, so close monitoring is important. If you are pregnant, it's essential to discuss the risks and benefits of using this medication with your doctor, as it should only be used when clearly needed during pregnancy. Lastly, it is unknown whether this drug passes into breast milk, so consult your doctor before breastfeeding while using Coly-Mycin and Parenteral Vial. It's important to be aware that Coly-Mycin and Parenteral Vial may interact with other medications, which could impact how they work or increase the risk of serious side effects. This is not an exhaustive list of potential drug interactions, so it's crucial to keep a record of all the products you use and share it with your doctor and pharmacist. It's important to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. One specific product that may interact with Coly-Mycin and Parenteral Vial is cephalothin. Be sure to discuss any concerns or questions about potential drug interactions with your healthcare provider. If someone has overdosed and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include extreme drowsiness, slow or shallow breathing, muscle weakness, and inability to move. It's important to remember not to share this medication with others. When using Coly-Mycin and Parenteral Vial, it's important to have regular lab and/or medical tests, such as kidney function tests. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you miss a dose of Coly-Mycin and Parenteral Vial, it's important to consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. For inhaled doses, if you miss one, use it as soon as you remember. However, if it's close to the time for your next dose, it's best to just skip the missed dose and use the next one at the regular time. Again, do not take a double dose to make up for the missed one. When using Coly-Mycin and Parenteral Vial for inhalation, it is important to store the unmixed vials at room temperature. It is crucial not to use pre-mixed solution or prepare the solution ahead of time, as this can lead to serious breathing problems. The inhalation solution should be prepared right before use, and any unused solution should be discarded after 24 hours. It is not recommended to store the solution for longer periods of time. It is important to keep all medications away from children and pets and to properly discard the product when it is expired or no longer needed. Always consult your pharmacist or local waste disposal company for proper disposal methods. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.